What is this?
Yeah.
What is this? Carina, yes. And this one?
Secondary.
Primary and secondary.
Yes. Which primary?
That's the left.
Left primary.
Secondary.
Tertiary.
Tertiary.
Is this tertiary?
Branch.
Is this tertiary? No. When the colored portion is coming off the secondary, that is tertiary. Then this is divided again, right? So this, where it begins, the colored portion begins, that is tertiary. Okay?
So the color part is tertiary.
Yes, but where this portion, after that, this is fourth order branch already. This is tertiary, this is fourth order. Okay. All right, what is this? Yes, please. What is this cartilage?
Cuneiform.
See? Cricoid cartilage. Narrow, anteriorly, broad, posteriorly. What is this A-shaped cartilage?
Arytenoid.
Arytenoid, yes, and be able to write them, please. Otherwise, you won't get a. Okay, what is this?
Glottis.
Epiglottis. Epiglottis, okay? All right, and then let's have a look at this. So what is this?
Those are false.
False what?
Vocal cords.
Vestibular fold or the false vocal cord. And this one?
True, which
True
is
what?
vocal cords.
Okay, and this?
The really glottis?
Where have you guys been?
That one looks different than on the other one.
This is the see, this is the epiglottis, please. When you cut it, you see the blue cartilage here. This is mucosa covered epiglottis. This is the epiglottis. And so, what is this cartilage? Thyroid. What is this? So be able to recognize them in the sagittal view. I will be putting them like this. Alright, so this is cricoid. And this is thyroid. Thyroid is deficient at the back. Posteriorly, this is cricoid. This is thyroid. This is epiglottis. All of this is epiglottis. False vocal cord and true vocal cord. Okay? Alright.
So then where's the glottis?
Good question. Alright. So when you look like this, when you look down like this, you see the true. It will be very difficult for me to put an arrow there for the exam, but I'm showing you where the glottis is, and I've shown you before. So when you look down, you see the two white true vocal cords?
Yeah.
Mhm.
They, and the space between them, that is the glottis. Alright? Okay, please, who does this belong to? Yes? Your people? Alright, so in this?
That's the
Yes?
coracoid cartilage.
What is this cartilage, please? The thyroid. What is this?
That's the hind.
What is this?
Epiglottis.
What are these?
Arachnoid.
This one?
That is the
Coracoid.
Who does this belong to?
there was a
Alright, so in the nasal septum, yes, this is the septum, this is the eye, the nasal cavity of one side is the septum, and then you look at the bones in this direction here. So this is your perpendicular plate of ethmoid, and this is your vomer. What is this? Sphenoidal sinus, and this one is frontal sinus. Alright, so please just I need to put this back. Please
go.
Okay. All right, so on here now, these are
The
sphenoidal sinus. This is, yes, sphenoidal sinus is the body of the sphenoid, with the sella turcica, with the pituitary. These are your sphenoidal sinuses, and these are
Frontals.
Okay, what is this?
That's the inferior concha.
Inferior concha. What is this?
That is the
The
meatus.
Which meatus?
Nasal.
Medial nasal meatus. And this is
That is the
anterior nares.
anterior.
And this kind of a passage leading from the nasal cavity to the nasopharynx here is your
Posterior.
posterior. So all of this area, posterior to the nasal cavity, above the soft palate is your nasopharynx. And then all of this area, posterior to the oral cavity, this is your oral cavity. Behind the epiglottis, posterior to epiglottis, this is your
Laryngopharynx.
laryngopharynx. What is this?
Oral pharynx.
That's the pharyngeal tonsils.
Pharyngeal tonsil.
Or
What is this?
That's the auditory.
Opening of the auditory.
Oh, that's what it's
tube.
at.
Okay, all right. What is this?
The soft palate.
What is this tip of the soft palate? What is this? What is this?
Are those the palatine tonsils?
Palatine tonsil. Palatine tonsil. And the rest we've just seen on the larynx, right?
Yes.
Okay.
Where's the lingual?
Where's the lingual?
Lingual tonsil is at the base of the tongue. It's not colored differently. And even if you look at the tongue model, this is the lingual tonsil. Okay? You have the tongue model here, the tongue model here. On the small larynx.
Oh, I give it back.
So this. So see, lingual tonsil is just this bumpy area here. And this is all lingual tonsil.
That's used though. On the side it looks.
I will be using this one for that.
Okay.
All right, so, and then, look at these. So this part of the lung,
Apex.
all right. And this,
That's the
which fissure? So this lobe,
That's the
superior lobe.
That's the inferior.
This fissure,
That's the horizontal.
so please know the lobes, know the fissures. What is this one
have to know.
small area?
Lobial.
Lobule, yes. One small hexagonal area is a lobule surrounded, which is supplied air by a bronchiole and its branches. What is this?
That's the something.
That's a cardiac notch.
What's the other fissure called? Is it oblique? What's that?
This one is oblique, this one is horizontal.
Horizontal.
Okay, so what is this?
The diaphragm.
Diaphragm. And so what is this indented area? If I put an arrow here, it's pointing to what area in the medial surface of the lung? Cardiac notch?
No, that's the.
This is your cardiac notch.
What's that cluster?
Is that
It is your hilum. Hilum. Okay, this
The
is
hilum is the cluster?
that's
cluster?
a se- oh.
No, there's no cluster. This indentation on the medial surface where the bronchus is entering, the vessels are entering, this is called the hilum.
Okay.
Okay, this is
the secondary.
That's the primary.
primary. Okay, and what are these red vessels here?
The red ones are the veins.
is
Pulmonary veins.
Pulmonary veins, and this is,
Pulmonary
the
artery.
blue one is the artery. Okay,
Arteries don't have the oxygen.
I'm sorry?
Which one? Okay, the veins got the oxygen. The arteries.
Well, not in the lungs.
The pulmonary arteries are, the pulmonary artery is the blue one. In the lungs, it's the opposite, okay? And the veins are the red ones.
Okay.
All right? And there you go, please take this.
Is that all of them?
Yes, please take this. All right, then there's this one. Let's have a look at this one. So this bronchioles because they just don't have cartilage, right? They just have smooth vessel. Respiratory bronchiole, alveolar duct, and these are all alveoli, and the collection of alveoli is called alveolar sac. So this is basically a pulmonary. This one again.
Pulmonary artery.
Arteriole is at the microscopic level. This is an arteriole, and this is a pulmonary venule, right? Right. So this is, and these are the pulmonary capillaries. The arteriole. Sorry, these small ones are the arteriole and venules. These you can say branches of the artery, small branches. Okay. All right. So in this model, you can kind of make out the pleura. Hardly, but you can. So this one here, the white covering. All right. So the white layer here, this, you see this? So what is this white layer?
Pleura.
Which pleura?
Is that the
Visceral inside.
Visceral has to do with the viscera, so it's covering the lung. So this layer here is visceral. This one lining the wall is
The cavity.
parietal pleura. Parietal pleura lines the wall of thoracic cavity. Visceral pleura line the lung. The space between them is
the pleural
pleural
cavity?
space. Okay, and that is all that we've done all this Fisher and etc. So we can review a little bit.